Welcome to the latest Voluntary Health Scotland podcast episode, where we talk to Rachel, a community link worker with Perth and Kinross Council, who speaks about her role as a link worker and how link workers play a vital role in her community.
Can you tell us your name, your role, and a little bit about where you work?
My name is Rachel Bauer. I am a community link worker with Perth and Kinross Council, and I cover the Strathmore area, which is where I live, which is great.
Oh, so it's very local.
Yeah, it's the first time I've had a job in the same place that I've worked, so it makes me feel really invested in the community, and I enjoy that much more than I could have imagined.
Oh, that's fantastic. And what's an average day like as a link worker, and what kind of issues do you see people facing in your local community or practice area?
Oh, it's a really interesting question. I'm not sure there is an average day. I have a kind of average week where there's probably more admin than I would have imagined for a job like this. I need to keep all my notes up to date. I need to make sure that I've got all my client kind of actions in some sort of a chronological order. So there's a lot of desk-based work, but I always try to break that up with having face-to-face meetings with clients wherever I can, because the contact that I have with people is really important to me. I feel that if I'm having a coffee with somebody or a walk with somebody, we get to the nitty gritty of what their issues are much more quickly than if I tried to talk to them in an email or over the phone.
How many appointments would you have on an average week, or how many people would you see in an average week?
I would say probably I'm looking at about 15 to 20 contacts with people, clients a week. So they vary, because when I start working with somebody, I will always meet them face to face. Because I just feel that that's the way that we can come to a good working relationship with each other and kind of get to understand what sort of positions people are in and what issues they're facing. As my work with them then moves on, I might take them out to groups, or I might be looking for more practical ways to support them. And sometimes I'll find out that actually they're happy with an email or just a catch-up phone call. And then as the work draws to a close, it's usually, again, a phone call or perhaps one last meeting. So in any given week, it'll be a mixture of the face-to-face initial quite intense visits, a fair amount of phone calls, texts, catch-ups, emails, and then for some of my other clients, sometimes it's just touching base every couple of months to just see that they're okay. But usually I've got about 20 contacts with clients over any given week.
Yeah, so it's quite busy and very varied, and I guess you have to be really organised to manage all of that.
Ideally, yes. I must admit it's one of the hardest parts of the job for me, because I get very invested in the people I work with, and some people are very needy in it. Their situation is meaning that they need help, and so it can get very easy to get drawn to one particular client. But I try to make sure that I'm treating everybody with the same level of support and respect, although some people's support is perhaps less than another person's. But that's actually one of the best parts of the job, because it means that I'm always on my toes. I'm always responding to people. I'll maybe get a phone call from somebody and they're suddenly not in a good place, and I'd aim to try to get to them immediately and not leave them hanging. And I think that's one of the big perks of being a social prescriber, is I can be quite reactive and responsive to people, rather than saying, we have a holding pattern, you will stay there until I'm ready to deal with you. It's like, no, what can I do for you? Let's try and get this to happen now.
Yeah, and I think that's one of the great things about a community link worker, being able to have that time and be responsive to someone in that moment of time.
Yeah, I quite agree. Yeah. I think it's what sets us aside from perhaps many other services, is that ability to be able to respond and hear what somebody's telling you. Because if they're in a crisis situation, it might not look like a crisis to anybody else, but if they're in distress, I think it can make a huge difference to feel heard and to know that a phone will be answered and that somebody might have a suggestion for you that could make some of that unhappiness go away. So, yeah.
So this might be quite a difficult question to answer, but do you think you could describe your role in 3 words?
I would say that my role is caring. In the first instance, I don't think this job would exist if you didn't have a genuine care and compassion for the people that you're going to come across. I'd say it's also very person-centered. It's important that you really try to listen to what the person's telling you, because they might have been referred because they've got anxiety. And it's important not to let that overshadow what you might discover in a conversation with them, which is actually that there's a lot of other issues going on, and anxiety is the least of their worries. But they have to know that, and they will often try and say, yes, I'm anxious, but I'm much more worried about this. So sometimes it's a case of being open to the idea that you might have the wrong idea about somebody and that you need to be open to that. So it's very much about having a flexible, open response to people. And now I don't know how many words I've used.
I think you've probably
Used too many.
covered it, Rachel.
Yeah.
Actually, yeah. I think caring and flexible and open and person-centered, I think, are really crucial to the role. What's the most rewarding part of your job?
The most rewarding part of my job is that it's so exciting. I absolutely get such a buzz from meeting people, learning about their stories and their trials and their tribulations, because the more people I meet, the more I realize that we're all the same. We all worry about the same things. We all have the same concerns at some level, and that life for any one of us is never a smooth road, and that at some point we are all going to trip up and stumble, and that act of feeling connected to somebody gives me a huge amount of pleasure. And so there's this feeling that we're all the same, and at some level or other we all need link workers. We all need to feel connected. And I think that very basic message is the one that I just find the most exciting, because it is so simple and yet so essential to all of us.
Yeah, and you mentioned earlier about how you enjoy feeling invested in your community, but do you find it more challenging being in a small, more rural community where people might know each other a little bit better than, say, being in an urban setting? Does that present any challenges?
Yeah, definitely. I think the main challenges for this locality are that I have quite a large rural contingent, people who really are at the end of a track, and that the act of accessing any of the services that I might normally recommend are harder because there is no physical way, if you don't have a car, to get to those things. But often in those scenarios, it's the community spirit in some of these more rural, isolated places that are actually stronger than I've seen in some of my city locations, because I have worked in per city historically. And I'll find that there's more of a community spirit going on with 15 houses at the end of a dirt track than there is going on in a sub-district of Perth. And so again, it's an interesting paradox that you've got some of the best, strongest sides of human nature come out in a situation where actually they haven't got perhaps the resources or the transport links that a city would have.
Okay, that's really interesting. Thank you. Just to go on to talk a little bit about the network. So what do you particularly value about being a member of the Scottish Community Link Worker Network?
Oh, well, again, it's back to this whole we're stronger the more people we're connected to idea. I mean, I think for me, the Link Worker Network is almost like my social prescribing service. As much as my job consists of talking to people every day for most of the day and interacting with people's lives, it's a really, really isolating job. I think we're all locality based, so often I don't have that much contact with colleagues physically, and it's difficult sometimes to remember that there is a bigger team out there and that there's a bigger organisation structure out there. And I think that's what the organisation does for me, is it reminds me that I'm part of something bigger. It allows me to share good practice. It allows me to remember why I'm doing this job, because the high points are shared, as far as I'm aware, between so many link workers. We're all saying the same thing, and it's just nice to remember that I'm part of something bigger.
Brilliant, thank you. And how important do you think link workers are to tackling health inequalities in Scotland?
Oh, absolutely essential. It's not a job I'd done before, and it's not something I'm trained to do formally, but there is so much in the way of inequalities, and I see that so much across the work that I do. And I feel that the people who need the help the most are the people who aren't able or in a position to access it. And I think that the beauty of social prescribing and link working is it gives people a space, a safe space in which to talk and express what matters to them. And then it gives them almost an advocacy or an advocate to take that information to where it needs to be heard. And so I think that it's such a privileged position that I'm in, to be able to listen to people, to have the time to listen to people, and to be able to take their concerns and their issues into the wider world.
Fantastic.
Which is, yeah, it's really good.
We met one of your clients this morning, Peter.
Yes.
So can you tell us a little bit about what it's been like working with him?
Oh, Peter's a legend. Peter was brought to me or put into contact through an ex-colleague of mine who works as a countryside ranger, saying that he thought that Peter might benefit from social prescribing. They'd had a conversation. So I got in touch with Peter, and I was quite new in post, so I didn't know what to expect. But right from the get-go, I kind of thought, here's somebody who is actually going to take everything that I can suggest and run with it, which is instantly a huge rewarding feeling for me. So Peter just has such an energy, a creative energy, but also a personal energy towards self-improvement. And he was so determined to not be classified by his conditions, which is quite unusual. Often people will use their physical and health conditions to define who they are, whereas Peter was actually doing completely the opposite. So his desire to get out and to learn new skills led him to do the Branching Out project at Templeton Woods, which was almost inconceivable because it was involving Peter learning how to use public transport, how to get literally cross country to get to the venue's starting point. He was meeting new people. He was doing tasks that he would never have been asked to do before, like planting trees and making bird boxes and lighting fires, meeting new people, getting himself home again. And on every level, you were almost thinking this is going to set him up to fail. But we broke it down into pieces. We looked at the transport, we looked at the group, we looked at the tasks, and Peter just did it. And it was just Peter's always been a real breath of fresh air, I think would be my words for Peter. He's just got such a capacity to absorb possibilities and to run with them. And that makes my job a pleasure.
Sorry, Rachel. And that must have given you a real sense of satisfaction as well to see him grow and develop in that way.
I mean, there were practical and simple things, and that you could see Peter's confidence starting to grow in that he was able to use buses to go quite a considerable distance to get to this task that he wanted to do. He'd gone from using a single cane, to using trekking poles because he found they gave him more stability and more confidence when he was on uneven ground. He joined a Nordic walking group so that he could use his trekking poles to greater advantage. I watched his artwork that had been monochromatic and quite sort of hesitant into just exploding into this riot of color and just, it was just like watching a butterfly. You're just like, go Peter, go Peter. He just took it and he ran with it. And it was just, the more I could give him, the more he took. And it was just an absolute joy. He still is an absolute joy.
Thanks for listening. For more information on Voluntary Health Scotland, please visit our website, vhsscotland.org.uk.